Due to enormous cost of medicines, a lot of family suffer financial breakdown in the attempt to save their family members. Some family members even die because they don't have the money to purchase drugs that will cure them from a condition.
Universal healthcare is very important to our country. As a low and middle income country, universal healthcare offers the kind of promise that will give citizens of our country access to healthcare in an equitable fashion.
It's been particularly inspiring and motivating to see people from different nations who are wrestling with the similar problems and the spirit of cooperation and sharing that has been throughout this dialogue.
I joined the war on cancer after I lost my son due to leukemia, and I know chronic disease in general and the cancer in particular requires a whole lot of money. And I can't tell you how much cancer affected my family and myself, emotionally, physically, and financially. So this is a gap we have in Ethiopia.
We're bringing together a wide range of countries to talk about their experiences, and we hope that as an outcome of this meeting, first of all, we have a better knowledge and an exchange of ideas of how different countries are moving along in the journey to universal health coverage. That we've also identified a number of hurdles and barriers that countries need to overcome in achieving that, and that we can see some of the good practices and some of the good experiences that countries have learned in this process that can also be applied in other countries.
Quality of drugs and services should serve as the enabling frame that begins, sustains, and grows any universal health coverage in any country.
My vision for the future of universal health care within integrated health systems is that everybody in the country would have access to a basic level of services, particularly including chronic disease services, and that nobody would be impoverished as a result of these normal health-related occurrences.
There's general agreement that the health goals should continue to focus on health outcomes, on reducing child mortality, reducing maternal mortality, attacking AIDS, TB, malaria, and chronic diseases. Universal coverage is absolutely essential to achieving all of those health outcome goals. There is no country in the world that's been able to achieve sustainable improvements across all of their major health areas without universal health coverage. In the short term, you can make progress with these separate vertical or focus programs, but you can't get sustained progress without the unifying force of universal health coverage.